Okay, I'm going to be changing a central line dressing today. First, I'm going to check with my orders 3 times. I'm going to verify the patient. I'm going to explain to the patient what I'm going to be doing. And I check my supplies and make sure that everything is up to date and not expired. And I'm going to wash my hands, and I'm putting my gloves on. And I'm also going to make sure I have a mask on and the patient has a mask on. And then I'm going to take the old dressing off. And I start from the bottom. And while I'm doing this, I'm just going to make sure that I kind of measure the tube from the bio patch to the tub here, just to make sure that I have an idea when I'm putting the dressing back on, make sure that it doesn't migrate. I also want to make sure that I'm not touching the insertion site. I'm doing this. I'm going to take my gloves off and wash my hands again. And then I'm going to open my dressing. Okay. And this is, I'm actually going to use this again just for demonstration purposes, but it's normally would be sterile, and I would place that in there. And the bio patch. And I open up my gloves. Okay, and then won't need these gloves. I'm gonna take that out. I already have the mask on the patient. And I don't need alcohol swabs because I'm going to use the chlorhexidine because the patient does not have an allergy. Just get everything open so I have everything together. And then this is the skin prep. And the dressing. Open that up a little bit so I have that ready. And the bio patch is in there. The first thing I'm going to do is clean the site here, everything that I'm going to be putting under the dressing. Use friction for 30 to 60 seconds. And also make sure I clean the catheter here. Everything that's going to be under the dressing. And I'll make sure it dries. And I'm gonna apply the skin prep so the dressing can stick about 30 seconds. And then we'll say it's dry. And then I'm gonna place this here and make sure normally I would undo the tape and attach it, but I'm not doing that today because we don't want to have it stuck to it. And then I'm going to get the bio patch. Sure it's sunny side up here. Place that there. And then I can get my transparent dressing. And I can use this because it's not, the back part's not sterile. It's not going to be on the dressing. And I can place this here. I'm going to use my label and put the gauge, date, and initials on here to the side so I can make sure I can monitor the site. And then I would measure from the top to the top of the catheter to the hub to make sure it hasn't migrated, and if it did I would do a chest x-ray. And that would be all. And I would also make sure that I document everything that I've done and make sure the patient's comfortable before I leave the room and wash my hands.